What's up, world? How y'all doing? How y'all doing? How y'all doing? You already know what the deal is. You already know what we're getting in today. We're doing NCLEX questions. You already know. You already know. What's up? What's up? How y'all doing? You already know the deal. We're going to be doing NCLEX questions today. I'm going to wait for a bunch of people to get here. You know what I'm saying? Hey, once we get 100 folks up in here, baby, y'all already know what the deal is. You already know what we're going to be doing. So make sure y'all like, make sure y'all share, make sure y'all follow, make sure y'all let everybody know that I'm here. Once we get 100 people, we can start jumping into these questions. Hope everybody had a good, good week, since Monday, since we last talked, or since we last was up on here, you know what I'm saying? So, what we doing? What we doing? How y'all doing? Today is Wednesday. Happy hump day. I guess if people still call it that, you know what I'm saying? So, let me know who you are, where you're from, where you're at in your nursing journey. Make sure you smash that like button. Make sure you share. Make sure you follow. Don't be greedy your whole life. You know what I'm saying? My name is Kevin. I go by the Boot Nurse on all socials. Make sure you guys go over there and check those out. Instagram, of course, TikTok, of course, YouTube. All the videos that I do on TikTok that have NCLEX questions go up on my YouTube. So make sure you guys go over there and check that out. Valerie, what's up? How are you? How are you? So make sure you guys smash that like button, you guys share, you guys follow, because that is what TikTok wants. That's like the trifecta to get the algorithm to be all up in somebody's face. I need to be all up in everybody's For You page because apparently I am for them or you or whatever. So yeah, how we doing? How we doing? Valerie, you're in New Mexico. I'm guessing that's what that is, right? New Mexico. Let's see what we got. If you guys are just now joining, we are about to do NCLEX questions. So make sure you guys like, share, follow, get it all out there. When we get 100 people up in here, then we about to go do our thing. What's up, Cass? Hey, so for those that are in here that are new, Nurse Cass, been a nurse for almost 20 years, right? And she works in corrections and she works psych. And she's actually one of my moderators. And she will fight you. At least that's what I usually put on Nuck If You Buck, but apparently, when I put it on YouTube, they don't like that, so I can't do it. So shout out to you, Cass. Appreciate you being here. Who is that? Is it Asra Kareem? Is that how you say it? Did I say it right? Shout out to you. Welcome. Hey, if you guys are new here, we are waiting for people to jump in here so we can do NCLEX questions. Once we get 100 folks up in here, we about to make it rain NCLEX questions. Hey, so I'm gonna just let y'all know right now. I was kind of going through some of these questions, and it's a lot of maternity, like a whole lot. So just be ready for that. Hey, and just because you're not an expert at it, that's okay. You're not expected to be an expert at everything. It's all about being familiar. It's the same thing when it comes to working out there, being a nurse, and all that good stuff. Scorpio Princess, what's up? What you saying no for? Oh, because I said maternity? Yeah, me having maternity exam. Hey, shout out to you, Emma. That's what I'm talking about. So hopefully this will help you. Good news, I've been promoted to regional manager. I can't fight no more. I got to be professional. Hey, shout out to you for being regional manager. Hey, if they got any remote jobs, you already know the deal. You can send them my way. You know what I'm saying? I'm all about those remote jobs, working from home, anything that's an educator position. I'm all good. I love that. So, hey, we got 81 people. Shout out to everybody in here. We're about to start NCLEX questions. I'm just waiting until we get a good amount of people up in here because I'm not going to sit here and do questions for people and, they don't want to be here. You know what I'm saying? So, Scorpio, it's okay. It's okay. Don't be scared of maternity. If you're scared, go to church. Oh, who's that? Is it Shani? You passed your NCLEX on Monday? Shout out to you. Everybody, all 100 of y'all, give Shani her flowers right now. Congratulations. Welcome to the greatest shit show on earth of being a nurse. At least since COVID. So shout out to you. Congratulations. And let us know which one you took. Did you take the RN? Did you take the LPN? Which one is it? Had maternity clinicals yesterday, just not for me. Hey, sometimes it ain't for you. I can tell you that right now. So, but shout out to Shani for passing that NCLEX. Khadijah, you passed yours on Monday too. So we got 2 people up in here that passed. That's what I'm talking about. Hey, for all y'all that passed their NCLEX, if this live has helped y'all, I need for y'all to send me a DM telling me how this has helped y'all. It really helps me out. If it helped you out, I'm super proud of y'all regardless. So, hey, yeah, just do that for me. So I can give y'all a shout out like on my website and all the other good jazz. All right. Hey, so we got 86 people up in here. Apparently nobody wants to do these questions. Y'all need to like, share, and follow and get it in front of folks. You know what I'm saying? You know what? Fuck it. It don't mean matter. We about to do this anyway. So without further ado, I'm going to turn this camera around so we can see what's going on. All right, cool. I think everybody can see that. Short says, I graduated. You graduated, studying for the NCLEX, failed once already. That's okay. So my question is, what are you about to do about it? How are you going to fix it? How are you going to fix that failure? All right, hey, so real quick, a little bit of housekeeping. I'm going to move this closer so y'all can see it. All right, cool. Hey, so we're doing NCLEX questions. Make sure you guys participate. Give me all them likes. Hey, like, share, and follow, y'all. That is the biggest and most important thing, all right, because it gets it out to people. Don't troll my chat. If you troll my chat, I'm going to ban that ass. That's exactly what you're not reading it incorrectly. That's what it says. I got these questions off nurselabs.com. I have created an NCLEX course. That course is $48 right now. Link is in my bio. And if you're looking for one-on-one coaching, you guys can check that out in my bio as well. So without further ado, let us jump into these questions. All right, here we go. Question number 1. A client with bacterial pneumonia is admitted to the pediatric unit. What would the nurse expect the admitting assessment to reveal? Is it high fever, productive cough, rhinitis, or vomiting and diarrhea? What are we thinking? Does it include NGN? Elizabeth, NGN essentially is how the questions are directed at you. Like I said, I got these off nurselabs.com. So if you're talking about like the case studies and stuff like that for this one does not have case studies. And it doesn't have the bow tie, and it does have select all that apply. So it does have those. So but can't see the entire question. Okay. Let me back it up some. Give me a thumbs up if y'all can see that. Just want to make sure everybody can see that. All right, cool. We got some A's going on over here. I forgot to put my stop clock over here. My bad. Sorry. All right. I'm going to give y'all about 20 seconds. We got A's. Okay, cool. Everybody can see that. Sweet. All right. Let's see what we got. All right. Got A, bacterial. Okay, A for bacterial with inflammation. So what is bacteria? I mean, what is it? So if we're talking about a bacterial pneumonia, what are the signs and symptoms of somebody that has that? I don't know why, but I had to change it, and my school just had 100% pass rate with the NGN. I don't know how. I don't know how either. That seems kind of weird. Because usually there's a couple of folks that fail, but we could talk about that. But here's our answer in 3, 2, wrong. I lied. Here we go. And our answer is a high fever, right? If a child with bacterial pneumonia, a high fever is usually present. Increased temperature or fever with tachycardia and or chills and sweats is a major clinical finding. Physical findings also vary from patient to patient and mainly depend on the severity of lung consolidation, the type of organism, the extent of the infection, host factors, and existence or non-existence of pleural effusion. All right. Hey, so really, really important. Physiological adaptation. I know that's kind of hard for y'all to see, but physiological integrity, third largest section on the NCLEX exam, right? And you always need to read your rationales on why it's correct and then understand why your ones are incorrect. I'm not IT. I'm in IT, not nursing. Well, cool. Welcome. Now you're about to be an honorary nurse. All right, here we go. Question number 2. Shout out to you, Jason. I see you out there. Where's Warm Springs at? Where y'all at? Warm Springs? I know y'all in here. Stop playing. Question number 2. The nurse is caring for a client admitted with epiglottitis. Because of the possibility of complete obstruction of the airway, which of the following should the nurse have available? Is it IV access supplies, a trach set, IV fluid administration pump, or supplemental oxygen? So what are we thinking? Hey, so if you don't understand, the pathophysiologies of these disease processes, or if you don't understand the ailments, this is where I would say you need to go back and understand and look at content. All right. Beverly says B, easy. Hey, some people don't know. You'd be very surprised. Anybody's curious, I got these questions off nurselabs.com. It gives away in the question. Yep. All right. 15 seconds. Hey, if you guys are new here, make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. All right. The trifecta that TikTok likes. Hey, we're going over NCLEX questions. I got these questions off nurselabs.com. All right, y'all. Got a bunch of people saying B, so let's check out what the answer is. Here's our answer in 3, 2, and of course, our answer is B, a tracheostomy set. For a child with epiglottitis and the possibility of complete obstruction of the airway, emergency tracheostomy equipment should always be kept at the bedside. prepare for intubation or tracheostomy, anticipate the need of an artificial airway. An artificial airway is required to promote oxygenation and ventilation and prevent aspiration. All right. All right, here we go. Somebody said, why not ET versus trach? Because ET2 wasn't an option choice. That's why. Just took my test over pediatrics respiratory today. Shout out to you, Savannah. All right, here we go. Hey, safety and effective care environment. That's a management of care, right? That's a management of care question. All right, here we go. Question number 3. A 25-year-old client with Graves' disease is admitted to the unit. What would the nurse expect the admitting assessment to reveal? Is it bradycardia, decreased appetite? Is it ophthalmos? I always mess that up. And then weight gain. What are we thinking? Hey, by the way, I'm not a 10-year-old trying to prepare for a spelling bee. So if I mess words up, sorry. I mean, I'm not sorry. I don't care. So I'm just going to say it anyway. All right. What are we thinking? So we got C's everywhere. All right, I'm going to give you all about 15 more seconds. If you guys are new here, we're doing NCLEX questions. I got these questions off nurselabs.com. Make sure you guys like, share, and follow. Smash that like button. Give me a follow because I'm cool sometimes. And make sure you guys share. Don't be greedy your whole life. All right? All right, here we go. Here we go. Here we go. All right, y'all. Here's our answer. Looks like there's C's all over the place. All right, cool. Here's our answer in 3, 2. And the answer, of course, is C. Ophthalmos often occurs with hyperthyroidism. Graves is caused by inflammation, cellular proliferation, and increased growth of extraocular muscles and retroorbital connective and adipose tissue due to the actions of thyroid stimulating antibodies. All right. The cytokines and thyroid stimulating antibodies activate periorbital fibroblasts and pre-adipocytes, causing synthesis of excess hydrophils. I'm just going to say GAG and retroorbital fat growth. Here's one thing I'm going to tell you guys. Half this shit, once you become a nurse, you're not going to be saying and you're not going to be looking at. However, we do want to make ourselves familiar, right? And this is a physiological integrity type of question. What's up, Camille? How you doing? Hey, we had 2 people in here already passed their NCLEX, so shout out to them. All right, here we go. On to the next one. So here we go. Question number 4. The nurse is providing dietary instructions to the mother of an 8-year-old child diagnosed with celiac disease. Which of the following foods, if selected by the mother, would indicate her understanding of dietary instructions? Is it a ham sandwich on whole wheat toast, spaghetti and meatballs, cheeseburger and ketchup, or a cheese omelet? What are we thinking? Shout out to all 98 of y'all in here rocking. Make sure you guys like, share, follow. We're doing these NCLEX questions. Got these questions off nurselabs.com. It's one of their comprehensive one. I can't remember which one it was, but it's one of their comprehensive ones. So you guys can go over there and check those out. Hey, free 99, baby, free 99. Is it Wilda? Thank you for the follow. Read the question, y'all. Yep. RTFQ. RTFQ, y'all. RTFQ. 15 seconds. Is it Elkel? Thank you for the follow. Appreciate you. All right, y'all. Here we go. Here's our answer. Look like we've got a bunch of people saying D all over the place. Cool. So, all right, cool. All right, got some A's. Okay. Throw some D's on it. All right. All right, here we go. Here's our answer in 3, 2. And the answer is D, a cheese omelet. A child with celiac disease should be on a gluten-free diet. I saw a bunch of people say gluten-free down there. When a child has celiac disease, gluten causes the immune system to damage or destroy villi. Villi are the tiny finger-like tubules that line the small intestine. The villi's job is to get food nutrients to the blood through the wall of the small intestine. If villi are destroyed, the child may become malnourished no matter how much he eats, or she, whoever. This is because they aren't able to absorb nutrients. Complications of the disorder include anemia, seizures, joint pain, thinning bones, and cancer. All right. I'm like, oh, okay. I see why okay, cool. I don't know how to say your name. I'm going to mess it up. So I don't want to mess it up. So, all right. So that's a health promotions and maintenance question. Okay. All right, here we go. Question number 5. Shout out to y'all. Question number 5. The nurse is caring for an 80-year-old with chronic bronchitis. Upon the morning rounds, the nurse finds the O2 saturation of 76%. Which of the following actions should the nurse take first? So this is a prioritization question. So what I need to do something right now or else my patient's going to die. So is it notify the physician, recheck the O2 saturation in 15 minutes, apply oxygen, or assess the pulse? All right, I'm going to give y'all 20 seconds. Air first, okay. Shout out to all 200 of y'all in here. We're doing NCLEX questions. Got these questions off nurselabs.com. Make sure you guys like, share, and follow. Smash that like button, share, and follow. That's the trifecta that TikTok likes. So this is B, then C. All right, Terry. Put it in reverse, Terry. All right, I'm done. I'm sorry. All right, y'all, here we go. Here's our answer, y'all. Here's our answer. Our answer in 3, 2, and the answer is C, apply oxygen by mask. Remember the ABCs when answering this question. Administer oxygen first to increase the O2 saturation level. Provide humidified oxygen as ordered. Administering humidified oxygen prevents drying out of the airway, decreases convective moisture losses, and improves compliance. All right. So definitely we have an O2 saturation that's low. We need to get that. We need to get that oxygen up. Right. We don't need them having any type of like hypoxic type of issues, you know, especially when it comes to the brain, right? Was it administer my sandwich in the break room? What? Hey, real quick, we're doing NCLEX questions. This is a little commercial break. Participate. Make sure you guys smash that like button. Don't troll my chat. You troll my chat, I'm going to ban that ass. Got these questions off nurselabs.com. 7-day NCLEX course, $48. Check it out in my bio. As well, if you need coaching for NCLEX, also check that link out in my bio. All right, here we go, y'all. Question number 6. Is there a way to hide the chat? I don't know, to be honest. Sometimes I wish I could, but I like talking to y'all, so it's all good. Question number 6. A gravida 3 para 0 is admitted to the labor and delivery unit. The doctor performs an amiotomy. Which observation would the nurse be expected to make after the amiotomy? Is it a fetal heart tone of 160, a moderate amount of straw-colored fluid, a small amount of greenish fluid, or a small segment of the umbilical cord? No clue? That's fair, Elizabeth. That's fair. Chrissy says B. All right, I'm going to give y'all 30 seconds. All right. So, hey, some people said that they had this test today while they were in school. So hopefully everybody's shouting out the answers. All right, 15 seconds. All right, we got B's. We got some folks saying A. Okay. Shout out to all 300 of y'all. We're doing NCLEX questions. Make sure you guys like, share, smash that like button, share, and follow. I need all these follows. I need all these friends and people to love me. Okay. All right, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B. And amiotomy is an artificial rupture of membranes, and normal amniotic fluid is straw-colored and odorless. Successful rupture of membranes most commonly is determined by the intermediate return of amniotic fluid from the vagina. This fluid usually is clear and odorless. Tiffany said, whoop. Hey, that's the answer right there, y'all. Hey, remember, in order to retain it, read your rationales, right? That's how you retain the information as you are studying. Physiological integrity. All right, here we go. Question number 7. The client is admitted to the unit. A vaginal exam reveals that she is 2 centimeters dilated. Which of the following statements would the nurse expect her to make? We have a name picked out for the baby. I need to push when I have a contraction. I can't concentrate if anyone is touching me. When can I get my epidural? All right. Shout out to all 260 plus of y'all. Hey, we're doing NCLEX questions. Got these questions off nurselabs.com. Make sure you guys smash that like button. Make sure you guys share because you ain't greedy like that. You know what I'm saying? And make sure you guys follow me. I'm kind of cool sometimes. I really got the strangest urge to listen to Cry Me a River, but whatever. My bad. I'm just being petty. 15 seconds. Guys, it's A. It could be. Epidural. D. All right, user 71. I see you saying D. All right, y'all. Okay, here we go. Here we go. Here's our answer, y'all. Here's our answer in 3, 2, and the answer is D. When can I get my epidural? Dilation of 2 centimeters marks the end of the latent phase of labor. During the latent phase, the cervix dilates slowly to approximately 6 centimeters. The latent phase is generally considerably longer and less predictable with regards to the rate of cervical change than is observed in the active phase. The normal latent phase can last up to 20 hours and 14 hours in nulliparous and multiparous women, respectively, without being considered prolonged. All right. So that's latent, active, right? Remember those different stages and those phases of labor. It may pop up somewhere. It may. She didn't need to worry about an epidural. Hey, you can't tell her what she can worry about. I'm just saying. Hey, get that epidural. Hey, get the pain below them hips. You know what I'm saying? Fix it. All right, here we go. The client, for question number 8, the client is having fetal heart rates of 90 to 110 during the contractions. The first action the nurse should take is reposition the monitor, turn the client to her left side, ask the client to ambulate, prepare the client for delivery. What are we thinking? Shout out to all y'all. Hey, make sure you guys like, share, follow. Don't be stingy. Let everybody know we out here. Hey, so after we do these questions, I do an AMA. So if you guys want to hang around and ask questions about, nursing school, NCLEX, military questions, I get a lot of those. So 15 seconds. Appreciate Angela. Appreciate the follow. Thank you. Caitlin says B. Anything OB related, I choose answers that talk about the fundus. Hey, that's fair. Brandy and Destiny, thank you for the follow. All right, y'all, here we go. Jesus, is that you with the cross? Thank you for the follow. Tiffany, thank you for the follow. All right, here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B. Turn the client to her left side. The normal fetal heart rate is 120 to 160. 100 to 110 is bradycardia. The first action would be to turn the client to the left side and apply oxygen. A slow heart rate or bradycardia may indicate the baby is not getting enough oxygen delivery to the brain. A fast heart rate or tachycardia may indicate oxygen deprivation. This is an acceptable range of acceleration and deceleration, or speeding up and slowing down, of fetal heart rates during contractions and labor. All right. Hey, so remember that babies, their heart rates in utero, they're gonna go up and down. They're gonna be all over the place, right? Yeah, exactly. Remember lion pit, right? Left side IV O2 notify, right? And then was it Pitocin, right? Yep. Yes, we're doing NCLEX questions, fall Pandora. That's what we're doing. Hey, physiological integrity. Okay, that's where it falls under. All right. Shout out to the male nurses. Shout out to you, sir. Shout out to you. All right, here we go. Question number 9. In evaluating the effectiveness of IV Pitocin for the client with secondary dystocia, the nurse should expect what? A painless delivery, cervical effacement, infrequent contractions, or progressive cervical dilation. So what are we thinking? What are we thinking? Shout out to all 250 y'all. We're doing NCLEX questions. Got these questions off nurselabs.com. Make sure you guys smash that like button. Make sure you guys share because you're not greedy. And make sure you guys follow because you're also not greedy. 20 seconds. All right, Jason, I see you. You got the answer. I got you. I wonder where Warm Springs is at. They're supposed to be up in here. All right. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is D, progressive cervical dilation. The expected effect of Pitocin is cervical dilation. Oxytocin is indicated and approved by the FDA for 2 specific timeframes in the obstetric world, antepartum and postpartum. In the antepartum period, exogenous oxytocin is FDA approved for strengthening uterine contractions with the aim of successful vaginal delivery of the fetus. I take OB in a few weeks, so this is helpful to get a little insight. Okay, shout out to you. I knew it was going to be helpful for somebody, What up? I see you. Who called me HM1? Hey, why y'all be doing me like that? My goodness, I don't like OB. Look, let me tell you, when I did OB, like labor and delivery when I was in nursing school, look, I'm telling you, if you already know the story, when I walk in a room and I see, 4 or 5 different dudes with one woman and you're trying to find out who baby daddy is, you might as well just had a camera in there and just had Maury sitting in the corner with a DNA test. I'm just saying, that's just me. Hey, here we go. Question 10. A vaginal exam reveals a footless breech presentation. The nurse should take which of the following actions at this time? Anticipate the need for a cesarean section, apply the fetal heart monitor, place the client in the genupectoral position, perform a ultrasound exam. I'm not even gonna lie to you. Answer C. Never heard that word before. First time ever. I don't even remember that in school. Shout out to all 300 plus of y'all that are in here. Make sure you guys like, share, follow. We are doing NCLEX questions. Got these questions off nurselabs.com. I'm going to give y'all 15 more seconds. Scorpio says B. Hey, shout out. Hey, anybody up in here a Scorpio? Scorpio season right around the corner. Right around the corner, y'all. Scorpio babies. Planned Parenthood should be encouraged. This guy. Doesn't matter which NCLEX it is, honestly, because it really doesn't matter. You just need to know what you can and can't do and what you can and can't accept as an LPN. Biggest thing is content. All right. Was it Elena, you a Scorpio baby? That's what I'm talking about. All right, here we go, y'all. Here's our answer in 3, 2. And the answer is A, apply the fetal heart monitor. Applying a fetal heart monitor is the correct action at this time. Fetal heart sounds are heard high in the abdomen in breech presentation. Be certain to monitor the fetal heart rate and uterine contractions continuously to detect fetal distress early and provide prompt intervention. Scorpio, I didn't write these questions. That's what they're saying, okay? No, you didn't come in here, Camille, say anything about Cancers and Virgos. Don't nobody care about y'all. I'm just playing. Shout out to all y'all. Hey, just because you like to do zodiac signs doesn't mean you can be an asshole, okay? Just saying. You said A. Oh, my bad. You're right. It does say B. That's my dyslexia, acting a fool. All right. Hey, real quick. Commercial break. Make sure you guys participate. We're doing NCLEX questions. All right. Make sure you smash that like button. Make sure you guys share. Make sure you guys follow. Give TikTok what it wants so it can bring me what I want, which is more of y'all. All right. Don't troll my chat. You troll my chat, I'm going to ban that ass. Got these questions off nurselabs.com. 7-day NCLEX course. Pre-launch phase it's in its pre-launch phase for $48. I have 42 content videos up in there, y'all. 42. And if you need help with NCLEX, I do a 15-minute coaching call. You can check that out. That link is also in my bio. All right. But Cancers and Virgos, what'd I say? All right, here we go. Question number 11. A vaginal exam reveals that the cervix is 4 centimeters dilated with intact membranes and a fetal heart tone rate of 160 to 170. The nurse decides to apply an external fetal monitor. The rationale for this implementation is what? The cervix is closed. The membrane is still intact. The fetal heart tones are within normal limits. The contractions are intense enough for insertion of a internal monitor. So what are we thinking? Love me some Cancer men. First of all, I ain't even about to do all that. Hey, Scorpio gang, just like Slytherin gang. Those are the only two that matter. I'm gonna give y'all 20 seconds. Who said E? That ain't even an option up in here. What you mean? Shout out to all 400 of y'all. Got these questions off nurselabs.com. We're doing NCLEX questions. If anybody is wondering, make sure you guys like, share, and follow. Smash the like button, share, and follow. Don't be greedy your whole life. All right, here we go. Michelle says B. Valerie says B. All right, well, it's over. Valerie done already dropped her answer. You have an OV test tomorrow. A. Is it Carissa? This should help you. This should help you a lot. This should help you a little bit, right? Give you a little bit of insight on something, right? You can never have too much practice. All right, but here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is B, Camille. It says B up there. The nurse decides to apply an external monitor because the membranes are intact. The test is used to determine if a fetus is at risk for intrauteral death or neonatal complications, usually secondary to high-risk pregnancies or suspected fetal hypoxemia. The frequency of use is based on clinical judgment, but is common because it is non-invasive and presents a low maternal and fetal risk. However, the test does not hold predictive value and only indicates fetal hypoxia at the time of the test. Woo! Hey, that's a lot to read. I know that's small. I don't know if y'all can see that, but I'm trying to make it as as focused as possible, okay? Hey, physiological integrity, right? Third largest section on the NCLEX. We'll make sure when you always study, when you're studying, read your rationales. That is the way that you retain the information, okay? All right, shout out to y'all. Y'all some smarty pantses down there. All right, question number 12. The following are all nursing diagnoses appropriate for a gravida 1 para 0 in labor? Which one would be most appropriate for a prima gravida as she completes the early phases of labor? Is it impaired gas exchange related to hyperventilation, alteration of placental perfusion related to maternal position, impaired physical mobility related to fetal monitoring equipment, or is it D, potential fluid volume deficit related to decreased fluid intake? Hey, y'all, I've been recording videos like crazy for like the past couple of days, so excuse me if I start like stuttering, like I'm a stutter person. All right, here we go. 20 seconds, y'all. 20 seconds. Hey, if you're new here, we're doing NCLEX questions. I got them from nurselabs.com. You guys can go check that out for yourselves. Hey, but I also want to know who you are, where you're from, where you're at in your nursing journey, right? Pre-nursing student, nursing student. Did you graduate? Take that NCLEX? Let us know down in the comments. I want all your business right now. I didn't say that the next gen would have nursing diagnosis. And you're correct. They won't. And if they do, so here's the thing. Next gen could have nursing diagnosis. But if you are here's the thing, if you're starting to get easier questions that are like that, you might want to rethink some things. You may not be heading in the right direction when you're taking that exam, okay? Because remember, the test is computer adaptive. So if you get a question like that, you might want to rethink. You might want to start to reevaluate what direction you're going while you're taking this exam, okay? All right, y'all, here we go. Here is our answer. What's the answer, someone? Well, we're about to get there. What y'all in a rush for? Lord of mercy. All right, here we go. In 3, 2, and the answer is D, potential fluid volume deficit related to decreased fluid intake. Clients admitted in labor are told not to eat during labor to avoid nausea and vomiting. Ice chips may be allowed, but this amount of fluid might be sufficient to prevent fluid volume deficit. Provide clear fluids and ice chips. Provide clear fluids and ice chips as permitted. Helps promote hydration and may provide some calories for energy production. All right. So shout out to y'all that got this question right. Shout out to all 250 y'all in this part of physiological integrity, third largest section on the NCLEX exam. Okay. Here we go. Question number 13. As the client reaches 8 centimeters dilation, the nurse notes late decelerations on the fetal monitor. The fetal heart rate baseline is 165 to 175 with a variability of 0 to 2 beats per minute. What is the most likely explanation of this pattern? The baby is asleep. The cord is compressed. There is a vagal response. There is a uteroplacental insufficiency. Hey, I'm glad that who said I'm a lab scientist. Maddie, I'm glad you're here for it. Hey, shout out to all 265 of y'all. Hey, where are all my LVNs? Where are all my CNAs? Where are my MAs at? Where are my occupational therapists? Where are my PT people at? I love all y'all. Shout out to all y'all. All right. Hey, because we couldn't, as a nurse, you can't do your fucking job unless you have those folks that are up in there. I'm telling you right now. I love my patient care techs. I love them because I wouldn't be able to do shit without them when I was working. Straight up. Shout out to all y'all. VO Chop. Look at you. Shout out to all my LVNs. Okay, I see y'all out there testing for LVN, currently a military medic. Hey, so if y'all don't know that about me, I've been in the Navy for 16 years. I'm a hospital corpsman in the Navy, and I'm a surge tech. I'm a nurse as a civilian. I've been a nurse for 3.5 years. Worked in ICU, worked in PACU, and worked in the OR. And the OR is currently where I work at right now. So shout out to all y'all folks that are out there. Shout out to all 400 plus of y'all in here. Here's our answer, y'all. Here's our answer in 3, 2, and the answer is D. This information indicates a late deceleration. So somebody said veal chop up in here. This type of deceleration is caused by uteroplacental lack of oxygen. Late decelerations are one of the precarious decelerations among the 3 types of fetal heart rate decelerations during labor. They are caused by decreased blood flow to the placenta and can significantly implement fetal acidemia. Hey, I see you out there, average. I see you. Trust my gut. Hey, so if you pick your answer, by the way, when you pick your answer, 9 times out of 10, your first answer is your correct answer. If you 100% can't tell me why you're changing your answer, don't change your answer, because that's how you mess up. I'm trying to tell you. That's how you mess up. I'm a phlebotomist who decided to go be a nurse. Shout out to you. Christian, shout out to you. Here we go. Question number 14. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to what? Notify the doctor, start an IV, reposition the client, or readjust the monitor. Oh, okay. TikTok telling me I have at least 11 C's in a row. Well, then, of course, Scorpio Princess want to be different and put a D. So, whatever. The field chop is a godsend. Straight up. All right. 15 seconds, y'all. Yeah, way to be different, Scorpio. Way to be different. Shout out to all 300 and 300 plus of y'all in here. We're doing NCLEX questions. Make sure you guys smash that like button. Make sure you guys share and follow. Don't be greedy your whole life. All right. Got these questions off nurselabs.com, so you guys can go over there and check them out. They are free questions. So, hey, free is better than nothing. You know what I'm saying? So here we go. Individuals, super average. You're funny, guy. All right, here we go, y'all. Here we go. Here is our answer. Here's our answer in 3, 2. And the answer is C, reposition the client. See, shout out to someone else for being different and messing up the streak. The initial action by the nurse observing a late deceleration should turn the client to the side, preferably the left side. Administering oxygen is also indicated. Initial management of recurrent variable deceleration should be a target of revealing potential cord compression. Maternal repositioning is a reasonable first maneuver. Variable decelerations can be seen resulting from fetal movement if the fetus is premature. All right. So, hey, physiological integrity. There's going to be a lot of those that are on here. Make sure you guys are reading your rationales. OK, make sure you guys are reading your rationales. That is how you retain the information. All right. On to the next one. Question number 15. Which of the following is a characteristic of a reassuring fetal heart rate pattern? Is it a fetal heart rate of 170 to 180, a baseline variability of 25 to 35, ominous periodic changes, or acceleration of fetal heart rate with fetal movements? All right, we got a bunch of people saying D. Shout out to all 237 of y'all. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. Only if you're new here. If you're not new here, I don't want to hear nothing else about y'all. I don't know it all, okay? Send my class to this life. Send them here, Kayla. Send them here. All right, 20 seconds, y'all. But as I was saying, hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Scorpio, I don't want to hear nothing about you. Camille, I don't want to hear nothing about you either. Alexis, New Jersey, studying for NCLEX. Shout out to you, Alexis. Lindsay, shout out to you. April says, I'm not a nurse. Okay. Tell me what you do. I'm a baby nurse. That's okay, Ashton. New here, my 4th semester. Shout out to you. All right, y'all. All right, Camille, what you crying for? My goodness. You hear all the time. All right, here we go. Here's our answer, y'all. Here's our answer. Tori, shout out to you being a nurse for 2.5 years. NCLEX on Monday failed 3 times, but feeling super confident. Hey, always keep that confidence, because I'm telling you right now, it's all up to you to make that happen. All right, here we go. Here's our answer in 3, 2. And the answer is D, acceleration of fetal heart rate with fetal movements. Accelerations with movement are normal. Accelerations are transient increases in the fetal heart rate. They are usually associated with fetal movement, vaginal examinations, uterine contractions, umbilical vein compression, fetal scalp stimulation, or even external acoustic stimulation. The presence of accelerations is considered a reassuring sign of fetal well-being. Okay, prepare for my NCLEX exam foreigners here. Is it Smitty? Shout out to you, Smitty. Shout out to all 260 of y'all. Hey, this is a physiological integrity type of question. Always read your rationales, y'all. That is how you retain the information, okay? And this is mostly going to be like OB, not my choice. Hey, real quick, commercial break. Commercial. Participate, y'all. I'm kind of funny. Probably not. It's Wednesday, but, work with me. Hey, make sure you smash the like button. Make sure you guys share and make sure you guys follow. Don't be greedy your whole life. Give me all them likes. Give them all to me. All right. Hey, you troll my chat, I'm going to ban you. It says it right there. I'm going to ban that ass. So please don't be that person. Don't be rude. All right. Be respectful of everybody. I got these questions from nurselabs.com. So if you guys want to go over there and check that out for yourself, you guys are more than welcome. 7-day NCLEX course is a course that I created. It's in its pre-launch. It's $48. You get it for a lifetime. That includes all updates, which are the updates that are coming out. I got 42 videos in there, so check it out. Also, if you need help with NCLEX, like one-on-one coaching, you can book a call with me. You can look at that link, and that is also in my bio. All right, here we go. Question number 16. The rationale for inserting a French catheter every hour for the client with epidural anesthesia is what? The bladder fills. The bladder fills more rapidly because of the medication used for the epidural. Her level of consciousness is such that she is in a trance-like state. The sensation of the bladder filling is diminished or lost. She is embarrassed to ask for a bedpan that frequently. All right. What do we got? Hey, look. Okay, I see y'all out here. I see y'all. Y'all some smarty pantses out here. Hey, just like some people will come in here and say, hey, yo, this is easy. Okay, it may be easy for you. No one knows where you are at in your journey, if you're already a nurse or if you're just a smartass. And I mean that by mentally. I don't mean by defecating out of your mouth. I'm just saying that some people are in different stages of their learning process and they may not know this. And there's a lot of people in here that aren't nurses or doctors or whatever. So just be mindful of that. All right, I'm gonna give y'all 10 seconds. All right. Connie says C. Hey, yo, this is easy. Camille, you about to get a 600. You about to get one. You tested me today. It must be the Wednesday test that you're doing to me. It's not easy, but practicing helps tremendously for sure. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is C. The sensation of the bladder filling is diminished or lost. Epidural anesthesia decreases the urge to void and sensation of a full bladder. A full bladder will decrease the progression of labor. Under the influence of epidural anesthesia, patients may not feel the urge to urinate, which can result in urinary retention and bladder overdistension. Overfilling of the bladder can stretch and damage the detrusor muscle. For example, the use of lumbar epidural anesthesia for labor and delivery has frequently been implemented as a causative factor for postpartum urinary retention. This is supported by the fact that these patients demonstrate a difficulty voiding. Okay. Hey, if you don't want me to read the rationales, I won't read them, but I like reading them because not only does it help you learn, it also helps me learn. And hey, here's another thing too. If you ever are trying to learn a subject, teach it to somebody else. That is once you're learning it like that and you say it to somebody else, you learn it that much faster. Okay. So that is my suggestion to everyone else. All right. I like you reading them. I appreciate it, Valerie. I get winded over here because sometimes I start stuttering. So you already know how that goes. Question 17, a client in the family planning clinic asked the nurse about the most likely time for her to conceive. The nurse explains that conception is most likely to occur when estrogen levels are low. Is it luteinizing. There we go. Luteinizing hormone is high. The endometrial lining is thin and the progesterone level is low. What are we thinking? Got B's. Shout out to all 250 y'all that are in here rocking. Hey, if you're new here, we're doing NCLEX questions. Got these questions off nurselabs.com. Make sure you guys go over there and check that out. Make sure you guys smash the like button. Luteinizing. I need somebody to send it to me in a message. I'm an auditory person. 10 seconds, y'all. Luteinizing. See, y'all got different. All y'all putting something different in here, but I got you. I'm picking it up. All right, y'all. Here's our answer in 3, 2. And the answer is luteinizing hormone is high. Luteinizing hormone released from the pituitary is responsible for ovulation. At about day 14, the continued increase of estrogen stimulates the release of luteinizing hormone from the anterior pituitary. The LH, I should have just said that. The LH surge is responsible for ovulation or the release of the dominant follicle in preparation of conception. Once occurs within the next 10 to 12 hours after the LH levels peak. You want the lining thick. Thick with 2 Ks. I got you. All right. Cool. All right, here we go, y'all. Here we go. On to the next one. Hey, health promotions and maintenance for this question. All right, health promotions and maintenance. Just think you want a. Hey, yeah, of course you. Hey, you need a thick cushion. That's what I'm saying. Thick. 3 C's. That's what I'm about. I love it for my life. Here we go. Question number 18. A client tells the nurse that she plans to use the rhythm method of birth control. The nurse is aware that the success of the rhythm method depends on what? Age of the client, frequency of intercourse, regularity of menses, or range of the client's temperature. Range of the client's temperature. All right, what are we thinking? Shout out to all 217 of y'all in here rocking. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. All right, I don't care if you're a pre-nursing student. I don't care if you're in nursing school. I don't care if you graduated. I don't care if you took the NCLEX 10 times. I took the NCLEX 3 times, y'all. I took it 3 times. You heard me right. And you would have never known that if you're not new here. You would have never known. 10 seconds. Amy said, been a nurse for 15 years. Shout out to you, Amy. All right, here we go. User 57. Ma'am, I ain't seen you in a minute. Preparing for NCLEX. Shout out to you, ma'am. All right, here we go. A nurse in Ghana. Shout out to you, Edith. All right, here we go, y'all. Here we go. Here's our answer in 3, 2, and the answer is C, regularity of menses. The success of the rhythm method of birth control is dependent on the client's menses being regular. Women are only fertile for a few days each year. No comment. I'm not going to say what I was going to say. Women using the rhythm method monitor their body and analyze their past menstrual cycles to try to determine when their fertile days are. They can then either choose to not have sex during those days or can use a barrier form of birth control such as condoms or spermicide. What, Camille? What I say that was funny? Man, I'm taking the mother baby right now. And yeah, it is a lot. It's a lot. Mother baby is a monster. Like, because you got 2 patients, 1 class for 2 patients, right? That's just kind of how it goes. All right. Hey, part of health promotions and maintenance. Okay. 9 to 12% of health promotion and maintenance is on the NCLEX. Okay. This looks too hard. It just depends. If you prepare for it, anything could be a little bit easier. You can get through anything if magic made it. I'm sorry. All right. My bad. Hey, question number 19. A client with diabetes asked the nurse for advice regarding methods of birth control. Which method of birth control is most suitable for the client with diabetes? Is it intrauterine device, oral contraceptives, diaphragms, or contraceptive sponge? What do we got? Got some A's. Okay, we got a bunch of A's in here. You got your maternity test tomorrow. Any advice? Study. All right, what do we got? 15 seconds, y'all. Is I don't know an option? Scorpio, you already know that answer. Why would you even ask me that? Come on now. Edith, thank you for the follow. Appreciate it. So if you're doing that maternity test tomorrow, think of, veal chop, when it comes to fetal heart tone or fetal heart rates. He says, fine, A. Think about, what's the other one? Lion pit, right? Left side IV O2 notify. Those are 2 big ones that you can implement while you're studying for your OB. No hormones. All right, here we go, y'all. Here's our answer. Shout out to all 300 y'all. In 3, 2, and the answer is C, diaphragm. The best method of birth control for the client with diabetes is the diaphragm. The diaphragm is a birth control device that prevents sperm from entering the uterus. The diaphragm is a small, reusable rubber or silicone cup with a flexible rim that covers the cervix. Before sex, the diaphragm is inserted deep into the vagina. I'm sorry. It's inserted deep into the vagina, so the part of the rim fits snugly behind the pubic bone. The diaphragm is effective I'm sorry, I'm looking at y'all. I'm looking at y'all laugh. My bad. The diaphragm is effective in preventing pregnancy only when used with spermicide. All right. All right. You knew it was C. Come on, Sarah. You knew it was C. I was bamboozled. I know it'd be like that too. All right, here we go. Hey, so here's a remember, make sure you guys are reading your rationales and you make sure you're reading your correct rationale and then read your rationales on why it is incorrect. All right. Somebody said something about hormones and that's a big thing. That's a big deal about it. Yeah. Menstrual hormones affect diabetes. There you go. Right. Question number 20. The doctor suspects that the client has an ectopic pregnancy. Which symptom is consistent with a diagnosis of ectopic pregnancy? Painless vaginal bleeding, abdominal cramping, throbbing pain in the upper quadrant, or sudden stabbing pain in the lower quadrant? What are we thinking? We got D's. We got D's. Jamie, thank you for the follow. Hey, if you guys are new here, make sure you smash that like button. Don't be greedy. Share, because other people may need this, right? And make sure you guys follow me because, I do these lives every Monday, Wednesday, and Friday at 5:30 Central Standard Time, Texas time, because that's the only time that matters. All right, 10 seconds, y'all. We got D's all over the place, though. It's Maggie Smitty. Thank you for the follow. Obviously, I don't know how to talk today. Every answer has been said. Okay. Here we go. Hot Donna. Thank you for the follow. Appreciate you. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is D. Sudden stabbing pain in the lower quadrant. The signs of an ectopic pregnancy are vague until the fallopian tube ruptures. The client will complain of sudden stabbing pain in the lower quadrant that radiates down the leg or up into the chest. Patients presenting with vaginal bleeding would likely benefit from a pelvic exam to assess for infections as well as access to cervical OS. My goodness. Bimanual pelvic exams additionally allow for palpations and bilateral adnexa. Oh my God, adnexa to assess for any abnormal mass/structures or to elicit adnexal tender. Hey, look, I've never in my life said adnexus, or if I have seen it, I just scroll right past that shit. Nope, I don't care how y'all are saying it. I'm not even about to pay attention, y'all. Not even about to pay attention. I hate the word. We're going on to the next one. Okay, physiological integrity. Read your rationales. Okay, that's how we retain these things. I'm pretty sure I had like 200, 300 people in here, and they just came here like, wow, this dude is dumb. He can't read. Let's go to another one. All right, here we go. Hey, commercial break, y'all. Commercial break. Make sure you guys participate. Give me all them likes. Make sure you guys smash that like button. Make sure you guys follow, and make sure you guys share. Don't be greedy your whole life, okay? Don't troll my chat. If you troll my chat, I'm going to ban that ass. So don't be rude, all right? I got these questions off nurselabs.com. So make sure you guys go over there and check that out for yourself. 7-day NCLEX course. That's a course I created. It has 42 content videos in there right now. And I'm working on the new generation NCLEX review right now. That link is in my bio, $48. You get it for a lifetime. And if you need one-on-one coaching for NCLEX, that link is also in my bio. Go check it out. Here we go. You got 5 out of 5 so far. Shout out to you. Here we go. Question number 21. The nurse is teaching a pregnant client about nutritional needs during pregnancy. Which menu selection will best meet the nutritional needs of the pregnant patient or of the pregnant client? A hamburger patty, green beans, French fries, and iced tea. Roast beef sandwich, potato chips, baked beans, and cola. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. Fish sandwich, gelatin with fruit, and coffee. What are we thinking? Hey, so here's a good, I love the nutritional questions. So when in doubt, what would you always pick? Just think about it. When in doubt, pick what? C, but B sounds good. Who said it? Baked chicken? Okay. It all sounds like a stomach ache. It really does, huh? What is 69? I mean, I know what 69 is, but that ain't no answer, okay? Fruit, veggies, and chicken. Fruit, veggies, and chicken. Okay. Pick healthy, right? You can't be out here like, yo, let me get a chicken fried steak. Chicken, protein, and veggies. Okay, shout out to you. All right, always pick C. What do you mean? Oh, stop it. Don't be telling people that. All right, here we go. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is C. Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea. All of the choices are tasty. Kind of like a stomach ache, but the pregnant client needs a diet that is balanced and increased amounts of calcium. This food contains, this food item contains meat, fruit, potato salad, and yogurt, which has about 360 milligrams of calcium. To maintain a healthy pregnancy, approximately 300 extra calories are needed each day. These calories should come from a balanced diet of protein, fruits, vegetables, and whole grains. Sweets and fats should be kept to a minimum. I wish I could say the same because your boy looks like Gucci Mane before he went to jail. All right, I'm just playing. But anyways, all right, here we go. Hey, shout out to y'all. Make sure you guys read your rationales. Health promotions and maintenance is the section that it comes from. Okay, here we go. Question number 22. The client with hyperemesis gravidarum is at risk for developing what? Is it respiratory alkalosis without dehydration, metabolic acidosis with dehydration, respiratory acidosis without dehydration, or metabolic alkalosis with dehydration? D, baby. Oh, man. Shout out to all 169 of y'all up in here, or 196. See, my dyslexia, y'all be acting up. Hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. We are doing NCLEX questions. Got these questions off nurselabs.com. If you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. You see, oh, look, I wish I saw that. I see 209 right now. So 15 seconds, y'all. 15 seconds. Edith says D. Carbon essence. I see D. You said, who said I just failed my NCLEX? You just failed your NCLEX? All right, so what you about to do about it? Acidosis, ass diarrhea. That's so funny. And that's going to be the best way to remember it, I swear. Emily is a psych MP from Maryland. Shout out to you. Waiting on my ATT. Okay. All right, y'all. Here we go. Here's our answer. Here is our answer. Terry is from Florida. All right, cool. Here we go. Answer in 3, 2. The answer is B. It is metabolic acidosis with dehydration. All right. The client with hyperemesis has persistent nausea and vomiting. With vomiting comes dehydration. Oh, yeah. When the client, look, hey, you can say it's wrong all you want. This is based off of what the questions are, okay? Didn't say it. Look, I'm just saying. When the client is dehydrated, she will have metabolic acidosis. In severe cases of hyperemesis, complications include vitamin deficiency, dehydration, and malnutrition. If not treated appropriately, Wernicke's encephalitis caused by vitamin B1 deficiency can lead to death and permanent disability if it goes untreated. You took it 3 times. I took my NCLEX 3 times too. So guess what? We are in the same boat. So here's the thing. You don't have to agree. You don't have to agree with the questions, right? They're not my questions. I didn't make them, right? But when I read this question too, I was just like, that's definitely wrong. In my opinion, I'm just like, that's wrong, because when you have vomiting and suctioning, that is alkalosis for sure, right? So I don't understand where this question got that one right. Not my question. I don't disagree with you, right? But when you go and you do your practice questions, all of them are not going to be right. I can tell you that right now. Out of 100, you'll probably get like 8 of them wrong. But it doesn't mean that just because you get them wrong or you think that they're wrong doesn't mean that you should fail your exam, right? It doesn't mean that at all. All right. So just be aware of that. Don't get all hung up on one question, because if you do, you're going to fuck yourself over. I'm just being completely honest. All right, here we go. Question number 24. A client tells the doctor that she is about 20 weeks pregnant. The most definitive sign of pregnancy is what? Elevated HCG, the presence of fetal heart tone, uterine enlargement or breast enlargement, and tenderness. B, and an A. Shout out to all 318 of y'all. This quiz again, please. This what? What you talking about? Okay, we got B's and we got A's. I ain't see no C's in there. Ain't no D's in there. Shout out to all 360 y'all. Yeah, AAA. Okay, all right. Emesis? What are you talking about? We don't emesis no more. That's gone. Shout out to all 400 y'all in here. We're doing NCLEX questions. If you're new, smash that like button. Make sure you share and make sure you follow. Don't be greedy your whole life. You know what I'm saying? We out here rocking. We got some smarty pants is up in here. All right, y'all. Here we go. Here we go, y'all. Here's our answer. Here is our answer. And 3, 2, and the answer is B, the presence of fetal heart tone. The most definitive diagnosis of pregnancy is the presence of fetal heart tone. The signs and answers A, C, and D are subjective and might be related to other medical conditions. Fetal heart tones can be appreciated between 6 and 8 weeks of gestation. Between 8 and 12 weeks of gestation, important information about the pregnancy can be obtained by the provider, including placental location, fetal position, and anatomy, amniotic fluid volume, the maternal anatomy, including dimensions of the cervix and uterus. Yep. Was the only positive sign of pregnancy is fetal heart tone, right? And if you accidentally take an X-ray and you see a baby in there, I'm just saying. So I'm just letting you know. It says, let's go. Just got home from Mother Baby Lab. Shout out to you, Trish. Hey, health promotions and maintenance. All right. Health promotions and maintenance. The only definitive way to know that you're pregnant, fetal heart tone. All right. Here we go. Question number 24. The nurse is caring for a neonate whose mother is diabetic. The nurse will expect the neonate to be what? Hypoglycemic, small for gestational age. Hyperglycemic, large for gestational age. Hypoglycemic, large for gestational age. Or hyperglycemic, small for gestational age. All right, what do we got? What y'all talking about in there? Is it Latoya? Thank you for the follow. Appreciate you. Appreciate all 291 of y'all in here rocking. Or now 317, but whatever. I swear the TikTok counter is bipolar. Y'all be acting up in here. Make sure you guys smash that like button. Make sure you guys follow, okay? I'm going to give y'all 15 more seconds. Is it Empress? You just graduated. Shout out to you. NCLEX is next. I know that's right. Gestational diabetes. Babies are enormous. Girl, you ain't lying. Be delivering elephant babies out here. 15 pounders. All right, y'all. Here we go. Here is our answer. Here's our answer. Lexi says B. All right, well, let's find out. Here we go. In 3, 2, and the answer is C. Hypoglycemic, large for gestational age. The infant of a diabetic mother is usually large for gestational age. After birth, glucose levels fall rapidly due to the absence of glucose from the mother. Hypoglycemia is caused by, hyperinsulinemia due to hyperplasia of fetal pancreatic beta cells consequent to maternal fetal hyperglycemia. Because the continuous supply of glucose is stopped after birth, the neonate develops hypoglycemia because of the insufficient substrate. I knew it was. I'm a doctor. So, okay. You're a doctor. That's cool. I'm not. Makes sense now. So that's why it's so important for you to read your rationale. Okay. That's why it's so important, because it gives you context for where you have that gap in your learning. Okay. So physiological integrity. My son, 9 pounds. Lord of mercy. All right, here we go. Question number 25. In the NICU for 1 week. That's a big baby. That's a big boy. How big is he now, Heather? How big is he now? All right, here we go, y'all. Here we go. Question number 25. Which of the following instructions should be included in the nurse's teaching regarding oral contraceptives? Is it weight gain should be reported to the physician? An alternate method of birth control is needed when taking antibiotics. If the client misses one or more pill, 2 pills should be taken per day for 1 week. Changes in menstrual flow should be reported to the physician. All right, we got B's. Shout out to all 300 plus of y'all that are in here. If you are new, make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. All right. None of the above. You must be new here, because I can guarantee you it's one of them. If you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. Talk about it. Let's talk about it. 10 seconds, y'all. Crystal says D. Is it Yessie? Yessie Jessie? Weight gain is normal. A B, B, B. All right, here we go. Here we go, y'all. Here we go. Here's our answer. In 3, 2, and the answer is B. An alternate method of birth control is needed when taking antibiotics. When the client is taking oral contraceptives and begins antibiotics, another method of birth control should be used. Antibiotics decrease the effectiveness of oral contraceptives. Antibiotics are suspected to diminish oral contraceptive efficacy by two main mechanisms. Induction of the cytochrome P450 group of hepatic microsomal enzymes and the interference of the enterohepatic cycle of whatever the fuck that word is, and I'm not saying it. So shout out to y'all for picking B, okay? Shout out to y'all. This is not really true. Okay, it doesn't matter. It doesn't matter if you think it's true. It's the answer that's there. And when the answer is presented to you, you got to pick one. You may not agree. But that's the answer that's there. Don't fight the grain. Don't go against the grain. Okay? NCLEX true, maybe not real world true. That's the thing about these tests. Okay? So shout out to everybody that got the answer correct. Okay? Shout out to y'all. Keep pushing. Can't go against the grain, and this is what the exam is all about. I'm just saying, it may not be true, you may not believe it. Don't matter what you believe. It matters what the tests say. You fight the exam, that ass is gonna fail. I'm just telling you. You're like, I don't believe it. I'm telling you from personal experience. All right, give me all them likes. Don't troll my chat, because if you troll my chat, hey, first of all, I love trolling people, and then I'll troll you, and then I'll ban you. So don't come in here being rude, okay? I'm really about that shit. I'm really petty, and I enjoy it, okay? So there's that. Nurselabs.com is where I got these questions from, so make sure you guys go over there and check that out. 7-day NCLEX course is a course I created because I failed the NCLEX 3 times, y'all. So I'm trying to pave a path so I can show y'all so y'all don't have to have that issue happen for y'all. All right, $48. That is on my bio. It's for a lifetime, only for the pre-launch. Once it's fully launched, it won't be $48 anymore, so make sure you guys go over there and check that out, okay? And if you need one-on-one coaching with the NCLEX, I do a 15-minute call. You can go ahead and book that. You can go check that out in my bio. Here we go. Shout out to y'all. Hey, who gave me a heart? Who gave me a heart? Hey, shout out to y'all. You know what I'm saying? Shout out to you. All right, here we go. Question 26. The nurse is discussing breastfeeding with a postpartum client. Breastfeeding is contraindicated in the postpartum client with what? Diabetes, positive HIV, hypertension, or thyroid disease. What in the hell was that noise? We got B's. Okay. All right, what else we thinking? Shout out to all 300 and however many of y'all that are in here. If you guys are new here, we are doing NCLEX questions. Got these questions off nurselabs.com. I want to know who you are, where you're from, where you're at in your nursing journey. I thought it was just my phone. I don't know what the hell happened. Maybe it was just another national alert and, we're being tapped. 15 seconds. B all day. Okay. Is it Abby? Okay, Abby. I'm an RN. B. Okay. I just want to let you know there's RNs in here and they get questions wrong. I don't even know why you said that. But whatever. Here we go. Here we go. Here's our answer, y'all. Here's our answer. In 3, 2, and our answer, of course, is B. Positive HIV. Clients with HIV should not breastfeed because the infection can be transmitted to the baby through breast milk. The best way to prevent transmission of HIV to an infant through breast milk is to not breastfeed. In the United States, where women have access to clean water and affordable replacement feedings such as formula, the CDC and the American Academy of Pediatrics recommend that HIV-infected mothers completely avoid breastfeeding their infants, regardless of ART and maternal viral load. All right, CRNA, and I got this shit wrong. Tyler, first of all, you a smarty pants. You got through CRNA school, but you got it wrong. I can't even deal with you. I love how nurses say, I'm a nurse. Hey, anybody ever seen that SpongeBob meme where he's just like he's bending over and I think he's possessed by a chicken or whatever the fuck, and they're just like, hey, look at me, I'm a nurse. Hey, I love the fact, first of all, I love all y'all. I'm just letting y'all know that right now. I don't care what your occupation is. Hey, but don't come up in here trying to be funny, because I'm going to roast that ass. All right, here we go. Question 27. A client is admitted to the labor and delivery unit complaining of vaginal bleeding and very little discomfort. The nurse first action should be to what? Assess the fetal heart tone, check for cervical dilation, check for firmness of the uterus, or obtain a detailed history. So what are we thinking? Okay, we got a bunch of A's in here. Abby says probably D. You know what? It probably is. It just might be. Shout out to all 500 of y'all in here rocking with me, yo. I want to know who you are, where you're from, where you're at in your nursing journey. Let me know. Stop being greedy. Make sure you smash the like button. Make sure you share. Make sure you follow. Be my friend. I'm kind of cool sometimes. I talk that shit. You know what I'm saying? Use Maslow's facts. There you go. Peoria. There you go. Peoria. New grad in the NICU. Shout out to you, Carrie. In the NICU, taking care of babies. All right. Just passed the NCLEX 2 days ago. Shout out to you, Nemi. Everybody give Nemi props. Welcome to the shit show. You already know the deal. All right, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is A. Assess the fetal heart tones. The symptoms of painless vaginal bleeding are consistent with placenta previa. Assess fetal heart sound so the mother would be aware of the health of her baby. Assess any bleeding or spotting that might occur to give adequate measures. Most cases are diagnosed early on in pregnancy via sonography, and others may present to the emergency room with painless vaginal bleeding in the second or third trimester of pregnancy. All right. Hey, OB is terrible. What website is this? This website, this isn't a website. This is just my desktop, but I got these questions off of nurselabs.com. All right. Prevo, whatever. Hey, well, didn't I tell y'all that I'm not a 10-year-old getting ready for a spelling bee on how to say stuff? Okay. All right. Y'all better quit. I'm literally going to ban the entire chat. That's what I'm about to do right now. Y'all keep playing with me. No, I'm just playing. I ain't going to do y'all like that. Here we go. Question 28. I should just get a shirt saying, I don't know how to spell. I don't know how to speak because I'm slow. I'm a real nurse. Let me stop. A client telephones the emergency room stating that she thinks that she is in labor. The nurse should tell the client that labor has probably begun when? You're telling me to simmer down. Ma'am, you about to get a 600. You keep playing with me, Scorpio. Keep playing. Her contractions are 2 minutes apart. She has back pain and a bloody discharge. She experiences abdominal pain and frequent urination, or her contractions are 5 minutes apart. What are we thinking? Scorpio says, hey, what? What, Abby? What happened? Shout out to all 300 of y'all up in here rocking with me, man. I appreciate y'all. Hey, we're doing NCLEX questions. Got these questions off nurselabs.com. So make sure you guys smash that like button, share, and follow. I want to know who you are, where you're from, where you're at in your nursing journey. That's a terrible selection of answers. Ain't it, though? Brandy says, I don't know. Got to give me one, Brandy. Give me one. Just pick one. She's in bed already? Look, that baby probably already out. Let me stop playing. Let's go with D. Okay, cool. Got you. Brandy says C. All right, cool. All right, here we go. Give me something. Don't just give up. Just give me something. You'd be surprised, even if you don't know. All right, here we go. Here's our answer, y'all. Here is our answer in 3, 2, and the answer is D. Her contractions are 5 minutes apart. The client should be advised to come to the labor and delivery unit when the contractions are every 5 minutes and consistent. She should always be told to report to the hospital if she experiences rupture of membrane or extreme bleeding. True labor consists of contractions at regular intervals. As labor progresses, these contractions become stronger and the time between each contraction decreases. NCLEX is tricky. Look for keywords. Yup, look for them keywords. Uh-oh, I didn't RTFQ. I done told you now. Hey, let them know. Let them know, Scorpio, what RTFQ means. If you're new here, Scorpio about to tell you. All right. Physiological integrity, third largest section on the NCLEX. Okay. At like 14%. Okay. Here we go. On to the next one. I'm so glad I work in the ER. See this all the time. Oh, look at you. Shout out to you, Antonio. Here we go. Question number 29. The nurse is teaching a group of prenatal clients about the effects of cigarette smoke on fetal development. Which characteristic is associated with babies born to mothers who smoke during pregnancy? Is it low birth weight, large for gestational age? Is it preterm birth but appropriate size for gestation? Or is it growth retardation in weight and length? All right, we got a bunch of folks screaming A at me. Okay. Terry, every time you put something, I see the damn emoji next to you. So I think that's your answer every single time. Rebecca says maybe. Oh, I don't know. You got to give me something. Hey, make a decision and run with it, right? Even if you're wrong, you're about to learn for why that answer is wrong. So that way you don't get it wrong again. All right, 10 seconds, y'all. A or D? Jessica, you got to give me one. Sammy says it's A. Okay. Shout out to all 400 of y'all in here. I want to know who you are, where you're from, where you're at in your nursing journey. We're doing NCLEX questions. Got these questions off nurselabs.com. All right, here we go. Here's our answer. Here's our answer in 3, 2, and the answer is A, a low birth weight. Infants of mothers who smoke are often low in birth weight. Smoking during pregnancy increases the risk of health problems for developing babies, including preterm birth, low birth weight, and birth defects of the mouth and lip. Smoking during and after pregnancy also increase the risk of sudden infant death syndrome, or SIDS. I know somebody specifically that was smoking her entire pregnancy and her baby was born with like a cleft lip or whatever she had going on. So that shit is real, y'all. That shit is real. Not a nurse, a sonographer. Shout out to you. Shout out to you. I'm just here for the roasting session. Look, I ain't roasting nobody yet, but I'm ready. I'm ready to do it. All right, here we go. On to the next one, y'all. Y'all are doing great. All right, here we go. Question number 30. All right. Let's see. Here we go. The physician has ordered an injection of RhoGAM, right, for a postpartum client whose blood type is A negative, but whose baby is O positive, right? To provide postpartum prophylaxis, RhoGAM should be administered when? Within 72 hours of delivery, 1 week of delivery, 2 weeks of delivery, or 1 month of delivery. All right. All right. Somebody just screamed like an A at me. First of all, I'm a person and you don't got to yell at me. OK, I don't know. B. Come on, Rebecca. Just say B. Just say B. It's OK. A, within 72 hours of delivery. All right, Antonio, I see you. Felicia. Bye, Felicia. That don't get old, don't it? A, I work in pharmacy. OK, shout out to you. All right. Here we go. 1 month is crazy, ain't it, though? You're just like, nah, he'll figure it out. Baby stuff is scary. It really is scary. That's why I don't work there at all. So, fun fact, you can volunteer as a... Oh, I didn't know that. That's cool. Jacob, thank you for the follow. Here we go. Hey, 10 more seconds, y'all. 10 more seconds. I do, Felicia. I'm sorry. I can't help. I'll stop. I'll figure out a way. I'll figure out a way to control myself. Obviously, I don't have any self-control out here. You know what I'm saying? So, here we go. Here we go, y'all. Here's our answer. Here's our answer in 3, 2. And the answer is A, within 72 hours of delivery. Oh, where are we at? To provide protection against antibody production, RhoGAM should be given within 72 hours. 1 dose of RhoGAM is usually given around week 28 of pregnancy and last about 12 weeks. If the fetus is Rh positive, the mother will also be given RhoGAM within 72 hours of birth. The baby's blood type can be determined easily after birth by cord blood samples. All right. So shout out to all of y'all that got that answer right. Y'all are such smarty pantses. Everybody that's in nursing school right now, y'all are going to rock y'all's exams. That's what I'm saying. Hey, I'm here for it. You like it here? Hey, if you like it here, smash the like button and share and be here, 3 times a week when I'm on here. You know what I'm saying? So there we go. Hey, and that, ladies and gentlemen, is it for our questions. Hey, but if y'all hang around, I'm doing an Ask Me Anything after this. I appreciate you guys hanging out and participating. I really, really do. I really enjoy being on here. I really love conversating with y'all. I'm all about it. I kid you not. If you got a 600, I'm not sorry because I'm petty over 9,000. But I don't think I blocked anybody today. So that's all good. Once again, I don't gatekeep. I got these questions off nurselabs.com. You guys can go over there and check that out for yourself. I don't know why I have that on there twice. Maybe it's just so I can reiterate to the fact that I'm not gatekeeping. Also, check out the 7-day NCLEX course. That is $48 for a lifetime. Go over there and check that out. If you need coaching for NCLEX, you can go over there and check that out as well. Link is in my bio. And now we're going to do an AMA. So now I'm just going to turn this camera around. And so that way y'all can see just my glorious face. I don't know why anybody would want to do that, but, I'm about to give some people what they want. Hey, but what's up, y'all? How y'all doing? Shout out to all 450 of y'all in here just listening to me run my mouth. Anyways, how y'all doing? My name's Kevin. I go by the Boot Nurse on all these other social media platforms to include YouTube and all that other good stuff. So make sure you guys go over there and check that out. But I want to know who you are, where you're from, where you're at in your nursing journey. Keep smashing the like button. Keep sharing and keep following because that's what TikTok likes. What's your schedule? My schedule, you can go check that. You can go check my schedule out. It's in my bio. But I do it. I do questions every Monday, Wednesday, and Friday at 5:30 Central Standard Time. Okay. But anyways, yeah, I want to know who you are, where you're from, and what questions do you guys have? Like, a lot of people are asking about ATI. A lot of people are asking me about, like, hey, what should I know for when I start my first job, so on and so forth. So a little bit about me. I've been a nurse for 3.5 years. I also have, I've been in the Navy for 16 years. So, and I've been an instructor in the Navy for the last 8. So got a little bit of teaching background, just a little bit. As well as I've worked in the ICU it was a little over a year. Then I worked in PACU, and then the rest of it has been in the OR. So Sweetness says, thank you I appreciate your support. Thanks for being here. I'm from Nepal, like where Mount Everest is at in Nepal. Damn, I made it all the way over there. That's what I'm talking about. Shout out to you. Is it Ashika? Did I say it right? Ashika? I'm a nurse in Mexico with 3 years of experience. How can I go work in the U.S.? So you would actually have to go. It depends on the state and the National Counsel to see if your license will transfer from Mexico to the United States, number one. And then number two is if they don't, you're going to have to sit for the NCLEX here. And I'm pretty sure that's what it's going to have to be. Didn't pass my last semester of nursing school. Why not? Why not, Alex? What's your opinion on the HESI? I hate the HESI. It's terrible. It was in my program. It was terrible. Ashika. Okay, cool. Would you recommend a new grad start out in PACU? Yes. I recommend a new grad go wherever they want, wherever their passion is at. Because when there's passion, the want for you to do better and to learn is there. I promise you. Now, if you don't know where to go, or if you med-surg is not a bad thing for you to go to. Okay. So I don't want people to I don't shit on med-surg because, first of all, I love med-surg. A lot of nurses over there were cool, but med-surg is a specialty, y'all. Don't forget that. Halfway through my first semester, shout out to you. From Nepal. You're from Nepal too, Sabrina? Okay. PACU is wonderful. It's like, in my opinion, it's like the holy grail in the hospital. What are your website recommendations for fundamentals of disease and treatment? I'm a first year. I would recommend, anything on YouTube, honestly, like Simple Nursing, Nexus Nurse, channels like that. They're great. Love the ER and looking to go to the ICU after I get my license. Shout out to you, Antonio. I think you might like that. I think you might like it. So it's high speed, and then it's all about managing that patient. Second semester nursing school maternity course is a struggle for me. Well, Gigi, I hope this helped you. I hope it helped. Yes, sir. Very fast pace and quick turnaround. Yup, it is. Any recommended state in the U.S.? Edith, what do you mean? To work? Already answered that question. Veronica says, graduate, getting for NCLEX. Shout out to you. You need to pass the NCLEX. You talking about me? User 71? I done already passed that a long time ago. Been in the NICU with my son for 6 months. Might go back with my BSN and get into the NICU. Do it, Alex. Do it. What's the best way to pass A&P? Study for it. But also there's a lot of, Khan Academy? I loved Khan Academy when I was studying for NCLEX. I loved it. Oh, I'm sorry, when I was in A&P. They use HESI to determine if you can continue on. Yeah, they did the same thing with me in my school. It's stupid. I didn't like it. Future LPN here. I love to see it. What you get on the MCAT. Not a doctor, so I got 0 because I didn't take that test. I'm struggling right now with maternity classes. Okay. So you need to look up maternity materials such as Nurse Sarah or Registered Nurse RN. There's tons of YouTube channels that break those down or actually in certain sections. Remar Nursing NCLEX. Remar's cool. Is Kaplan good? I love Kaplan. I actually did a review on Kaplan. If you go to my YouTube channel or if you go to my bio and you scroll all the way down, I actually have a series where I made a review of Kaplan. I love them. LPN here, starting in skills nursing facility now. Peds, hope to get back to RN soon. Shout out to you, or the best website for A&P. I told you that. Any recommendations going for LPN to RN? Talking about schools? I know Capella's a good one. I think Chamberlain's another good one. What's some other good ones out there? WGU. You just got to do that research. Your opinion on ATI to pass for passing NCLEX? I personally didn't like ATI, but I've seen it, and some people swear by it, some people don't. It all just depends on you, honestly. Be a travel nurse? I wanted to be a travel nurse. I don't want to do it anymore. What do you think about OR nurse? I'm an OR nurse, so I think it's cool. Don't work in Florida? Say no more. I won't. Any state in the U.S. that is good for me to work? I don't know where you want to go. Every state is different. Honestly, best study material for ATI Ts. Anyone? Jay, I would say Are you talking about ATITs like as an entrance exam? I would say if you're asking for that, it would be the Mometrics. It's a yellow Mometrics book that you can get off Amazon, and it's like $33. I found a Holy Grail hospital in Nebraska, and I'm sad I'm leaving to Florida. You ain't got to leave. Logan says, how you been? What's up, man? I ain't seen you in a while. Any good nursing schools in Texas? There's a ton. Marky says, I'm a prior corpsman and thinking of nursing or something medical, but I'm just undecided. Well, Marky, I'm going to let you know that nursing may not be what you want, but I mean, if you like medicine and if you like, patient care, then nursing is where you got to go. Any tips for HESI? Study for it. No question is a stupid question. That's true. I agree. I love registered nurse RN. I like her too, but hey, that accent is an environmental distraction. Just like, what's her name? Marlene Hurst from the Hurst Review. It'd be doing that to me too. Alex says, I'm in healthcare marketing. Okay. Already. So I have a good background and I've learned so much in the NICU. Well, shout out to you, Alex. Marketing will get you there. I'm telling you. Ninja Nerd on YouTube is good. Yeah, Ninja Nerd's good too. I have Remar and I hate it. Really? Kadeen, why do you hate it? Why do you hate it? Tell me why. YouTube is very good. Thank you. It says, everyone tells me not to go into nursing. So here's the thing. Everybody will tell you not to go into nursing. Hell, I will tell you not to go into nursing. But in the end, you have to go do what you want to do. You can't be basing it off of other people's opinion. Now, I can tell you the things to avoid to help your struggle not be as bad. But, in the end, you're going to do what you want. Simple Nursing is another good channel. Yep. Yes, sure is. ATI was not easy for me. It's all we had in school. Yep. It's a racket, y'all. HESI, Kaplan, ATI, it's just a racket. It's just one less thing that schools have to do. Do you have any tips on studying methods that can be transitioned from prereqs directly into learning styles? I got to sit and ponder on that one. Haven't seen you since Jax, man. How you doing? I'm doing good. G's or nursing. I don't know what that means. To concept learn. How long have you been a nurse? I've been a nurse for 3.5 years. Florida is literally a scary place for nursing. Well, I believe it. What's your life schedule? I already talked about that. I think I already answered your question. I passed studying the Kaplan Review before I took my NCLEX in 2009. Army paid for my nursing school. Okay, shout out to you. The Navy paid for mine. So X-ray tech. Hey, X-ray tech is cool. Texas grad almost. Anything UT is good. And put it this way. It doesn't matter where you go to school. I promise you, as long as that school is accredited, right, through the National Council and through your state's Board of Nursing, doesn't matter where you go. It does not matter where you go. Watch out for all these pop-up schools or, these, I call them pill mills, but watch out for them because they'll take your money and then they won't have accreditation. And then you'll end up like a Florida nurse or a Georgia nurse where they went to schools and they lost their accreditation. And it was just a mess. It's just a mess. I passed my HESI mental health. Hey, HESI mental health, shout out to you. Ohio has a great one. They do. Can you list some nursing schools in Texas? They got a bunch. I left the Navy in 21. So did I. I'm in the reserves now. So worked as a CNA, accepted in the nursing school today. Shout out to you, Sav. I'm a certified clinical nurse back home. Or are you what I have to do? I don't even know what you said. So many hospitals will pay for. Yep, hospitals will pay for you to go to school. Will go to you to school if you work for them. But the caveat is that you go back and you turn around and you work for them for 2 years. So if you have a terrible time, you may not like it. So can y'all pray for me? I got a test and HESI next week. I ain't praying. If you want me to pray for you, you better go to church. What's your life schedule? Just want to make sure I join on time tomorrow. Marie, my live schedule is every Monday, Wednesday, and Friday at 5:30 Central Standard Time. Okay. Let me see what y'all saying. Yolanda, what's up? What is the correct order for blood flow through the heart? I don't know. That's a great question that you could see when you're studying for anatomy. Got any tips for studying anatomy for prereqs? So Khan Academy. I'm telling you, Khan Academy is a good one. And another good one is ICU Advantage is a really good YouTube channel to look at as well. Can you work and also do clinicals? Yes, I had a full-time job like a lot of other people have. I had a full-time job while I worked while I was in nursing school. So you can do both. I'm going for my accelerated BSN. Can't wait to join the industry. I did an accelerated BSN program. It was 18 months. It goes by pretty fast and it's information overload. So you got to be prepared for that. I'm going for cost. Lone Star College in Texas is $5,000. Shout out to you. Because guess what? You about to get the same degree and the same license. Most importantly, the license. Sometimes you choose the right answer and it still marks things wrong and the content. Shaking my head. Oh, that's what you're talking about for Remar. Okay. As a matter of fact, I've heard people say that before. But I mean, all in all, it's still a review that has worked for people. Oh, okay. I feel like I should have stayed with Kaplan. Well, you got to think about it. It's just like all these reviews, they do work. They're proven to have worked. It all just depends on how you retain the information, right? The biggest thing is that you can't blame other people for your problems. And I'm not saying that you are, but you really got to take a step back and realize, like, what am I not understanding? Are they providing the information to me or are they just completely wrong? Remember, we're not perfect, but the majority of the things that are going to be in there are going to be the things that you need to know. Okay. How do you remember all the EKGs? The biggest ones that you need to know are the ones that everyone else needs to know when it comes to EKGs, such as asystole, right? VTach, VFib, AFib, A-flutter. Those are the big ones. Right? Oh, and of course, normal sinus rhythm, sinus tach, and sinus bradycardia. Okay. Those are the ones you need to know what everybody else knows, right? And if you don't remember like what torsades looks like, I'm pretty sure it's not going to be the end of the world, all right? But if you're talking about remembering EKGs working as a nurse, it comes with time. Like you'll start to see, you'll be like, oh, that looks like a preventricular contraction. Oh, okay, there's like 8 of them. Oh, that's a run of VTach. Oh, R on T. Oh, okay, so now this person's probably going to have this, right? NSTEMIs, right? So also think about NSTEMIs and STEMIs and stuff like that. How do you become a nurse in the Army? I wish I could tell you because I'm not in the Army. No, but in order for you to become a nurse in the Army, you have to go through an accredited school. You have to have your bachelor's degree and you have to have your license. And then you go find a nursing medical recruiter and they will take care of you from there. I worked 2 jobs starting in my 80 in August. Shout out to you. What else? It's complete memorization. What's complete memorization? Camille? You're welcome. All I know is asystole or however you spell it. Oh, okay. So we make fun of me on how I say stuff, but then you try to spell it wrong. No, I'm just playing. You spelled it right. I'm just playing. Shout out to all 96 of y'all. I had a good amount of folks up in here, but nobody wants to sit here and listen to me. But hey, I appreciate you guys being here. What other questions do you guys have? If you're new here, we are doing an Ask Me Anything specifically about nursing. My name is Kevin. I've been a nurse for 3.5 years. Yeah. What questions y'all got? I want to know who you are, where you're from, where you're at in your nursing journey. I'm in the ICU. Oh, in the ICU, you will learn your EKGs. The more you see them, the more you understand them. Study. I can tell you right now, Jay, when I worked in the ICU, it used to be me and a bunch of other people. Like I used to just sit there like this and just stare at them. And I'm just like, okay. Oh, that's a tombstone. Oh, and then other times I'm like, oh, PVC. And I would say them out loud because that's how I was able to remember them. I have too much fun in here. Camille, it's all good. Where do you work? I don't know. I work somewhere. See, that's what I'm saying, Jay. I just sit there and I'm just like, PVC. Oh. And then next you start to see a run of VTach. And I'm just like, well, this is going to be great. This is going to help me a lot. So taking my NCLEX on Saturday. Shout out to you, Ashley. So Ashley, if you're taking your NCLEX on Saturday, I better not see you here in my chat at all on Friday, because the day before your exam, you don't need to be doing nothing besides chilling out as much as you can before you go take your exam. Okay. Hi, I'm looking to get to become an aesthetic nurse, but not sure how to start. So most places that want you to do aesthetics, they want you to have at least a year of nursing. Doesn't say where, but they want you to have at least a year of nursing. Once you do that, you just turn around and you apply for the position. I work in the, oh my God, the OR. That's where I work at. They have a heartbeat, right? Can you repeat what you said about PVCs? No, I was just saying that I was staring at PVCs when I'm looking at the EKG monitor. Is NCLEX only multiple choice? No, NCLEX is multiple choice. Select all that apply. They have closed questions, which are like the drop down, fill in the blanks. They have bow ties. They have the highlights. They have anticipated versus unanticipated. They have the potential versus the not potential. What else? They have the case studies, right? They have the matrix grids. They have all different types, right? So they're not just multiple choice. However, multiple choice will make up the majority of your exam. It will make up the majority of your exam. Let's see. What if I'm not feeling completely confident? What do you mean, Ashley? Tips on perioperative nursing. Well, I don't know. I don't know exactly. I mean, tips on perioperative nursing. The biggest thing is that you have to have really good time management skills. And you definitely got to be a team player for sure, because you're working with surgeons, surgical techs, anesthesia, so on and so forth. Each facility will do something different. They have different requirements or whatever. So you definitely have to get down to your time management. The biggest thing in the OR is time. It's time stamp. So like when you get to patient, when you administer medications, when you get into the room, when the patient is asleep, when you're doing your prep, when you got the patient all staged and set up, and then when you do your timeout, because we always do a timeout before we do anything, right? We always do a timeout before we do anything to make sure we have the right, our 5-6 rights, right? Right patient, right time, dose, route, surgery, all that good jazz. So yeah, those are the things. Because you said don't be in my chat side. Oh yeah, that's right. I got you. I'm tracking. You're not feeling confident. I can tell you right now, no one feels confident when they go in and take that exam, Ashley. Nobody. What's your role in the OR, your circulator? Yeah, I just said that. Famika says, happy to see a black male nurse representing. Keep up the good work. I appreciate it. Yes, ma'am. Good news with the NCLEX. They have partial credit now. So Camille, since you know everything, what do they only have partial credit on? If you guys are new here, make sure you guys smash the like button. Make sure you guys share and you guys follow. Those 3 things is what the TikTok algorithm just wants. It puts it in front of people that need it. And, it puts it in front of y'all, and it brings y'all to me. And I want y'all to be here. It's like Uncle Sam. He wants you, but Kevin wants you to follow me and stop playing these games. All right. So, hey, if you're new here, make sure you guys let me know who you are, where you're from, where you're at in your nursing journey. What other questions do you guys have? I'm going to hang out here for a little bit. Probably maybe another 20 minutes. So whatever question you guys got, I'll try to answer them to the best of my ability. For the last couple of days, probably for the last 2 or 3 days, I have been working on my new generation NCLEX review. It is a monster of a review. It's going to be a part of my course. And just recording it is just a lot. I can't record it until late in the evening because I have an 18-month-old badass son who wants to scream. And the last thing I want is to be recording this video and then y'all hear him screaming in the background. Just don't make sense. Don't make sense at all. So if you're just now joining, we are doing an Ask Me Anything specifically for nursing. So what questions do you guys have? Jay says, 15-year nurse, ICU for the past 7, in school for CRNA school, North Carolina at the moment. Shout out to you. Hey, Jay, I think you're going to be a good CRNA out there. I think you're going to be good out there. Hey, you know who the paramurse is? Talking about my man Everett. That dude, I don't know, I'm not saying he's like one of the a famous CRNA guy out there, but he definitely got the following for CRNA. That dude right there, he and I actually did a TikTok and an Instagram live a couple of months ago while he was still in CRNA school, and because I was talking about the new generation NCLEX. That dude, and he sends me emails every so often, man, and I wish I could have just. He's done the things that I've wanted to do. And I wish that I could have just been like, you know what? Let me try CRNA. But then I realized that CRNA just wasn't in the cards for me anymore. But that dude, I am vicariously living through him. Like for real. So that's the dude to follow, man. You already follow him. So shout out to Everett. What else y'all got? What other questions do you guys have? About nursing school, stuff like that. Where are you? Where are you on? Was I on Lost? Oh, you're funny. You're talking about the show Lost? I wish I could tell you because I've never seen the show. I've never seen Lost. Never seen it. Are those zeros? Thank you for the follow. Catherine says, I'm going to be a new grad nurse at MedSurg Teleunit, tips and advice. Catherine, I would definitely say be a sponge. Everything is going to go fast. One of the biggest things I'm going to tell you is to advocate for yourself. Okay? I'm telling you, listen to me. New grad nurses get ran the fuck over by doctors who talk fucking crazy out the side of their face, as well as other nurses being rude and disrespectful. So I want for you, while you are learning, because you are still a new grad, don't let people disrespect you out here. We're supposed to be a team. We're supposed to be a team and we're all supposed to learn from each other. Ask as many questions as you can. Don't let people be disrespectful to you, and advocate for yourself. Don't be surprised if they try to do a 6-week orientation and everybody's like, hey, we don't got enough people. And then they're just going to let you off. Okay. Be prepared for that. Be prepared for that. Okay. However, one of the biggest things I'll tell you is to advocate for yourself, but also be a sponge, right? Take in everything that your preceptor tells you, or preceptors. Hopefully yours will be better than mine, because I had 9 preceptors when I started in the ICU. When I started in the ICU in a civilian hospital. Let me state that. When I worked at the burn center, I had 1. No, I had 2. But when I got to a civilian hospital, I had 9, and it was fucking terrible. So advocate for yourself. I'm going to go ahead and go. I'm going to head out. Okay. Got clinics in the morning. All right. Shout out to you, Camille. You look exactly like the actor. I get told I look like a lot of folks. I ain't gonna lie to you. Nurses eat their young is a real thing. Remember, this is your journey. You got this, everyone. Facts. Let them know, Jay. It says, how do you feel about LPN to RN? Would you recommend? Absolutely. Absolutely. Like, if you want to go RN, go be RN. That's another thing too. LPNs are nurses, y'all. LPNs are nurses. I don't know how many times I got to tell. I learned wound care from LVNs. When I worked in the burn center, they taught me so fucking much, man. I hate how people are just like, I'm this, I'm that, I'm better than you. I'm like, bro, we're on the same fucking team. And it might just be the military aspect of me, because it's just like, I'm looking to the person to the left and to the right with me, knowing that, hey, we about to rock, ride or die. But when I come out here to be this civilian shit, I'm like, I'm a 2-year RN, but then it's just like, I'm a 4-year RN. And I've seen people, I have my bachelor's, I have my associates. I'm like, who the fuck cares? Who cares? Or I have an LVN and a 2-year RN. I'm like, they were just like, oh, I'm this. I'm like, who the fuck cares? Who cares? Help me so I can help you. That's all that matters. That's all that matters. And I hate when people shit on fucking patient care techs. Now it's different if you're a patient care tech, or, you know, and you guys are rude and doing all this shit to one another. Like me, I don't play that. Like, you're not going to talk to me. I'm going to like, hey, just do what you need to do. Do what you need to do, and we ain't going to have no problem. Like, if you got a problem with me, cool, come tell me. And it might just be a man thing. Because I've had female nurses that have come to me and said something. I'm just like, hey, I'm not your husband and I'm not your son. I'm going to need for you to check your tone, or don't fucking open your mouth to me. Then I ended up in HR. And let me tell you how that went. No, I'm just playing. I didn't end up in HR, y'all. I'm just playing. But seriously, it's like, people don't have any respect for one another. And it's just like, look, people don't have any respect for one another. And I can tell you right now, you ain't coming to me and you ain't going to talk out of the side of your face. You ain't going to talk out of the side of your face without fucking repercussions. I'm letting you know that right now. So just saying. So for Catherine, ma'am, specifically for you, since you asked that question, if you're still here, stand up for yourself. Advocate for yourself. It's only one of you. Okay. Christina says, right. Thanks for answering. You're welcome. And ambitious. That is also for you as well. No, you on point. I'm trying to tell you, man. HR smiles on my same. Oh my, look, people out here playing with me. I don't like people playing with me like that. Bella says, any help with patho, please? First of all, I loved patho, right? I loved patho. That was like my favorite class. I mean, understanding the disease processes and how they affect the body. That is everything. That's everything that you would remotely need to know for the most part. But I would definitely look on YouTube. Khan Academy, great stuff for patho. Patho was my favorite class. I think I got the highest grade. I got like a 97 or some shit like that. And I studied for that. And I'm just like, oh, like I enjoyed it. So I would have anything on YouTube. Like Khan Academy is a good one. Nexus Nurse is a good one. Yeah, I would definitely look into those. Let me see. How often do they drug test in nursing school? Denisha, why are you asking me that? What you out here doing? I'm just playing. They usually drug test you before you go, before you get accepted into school. However, they do have the right to drug test you whenever they want because you are in a program to become a nurse. Just saying. Just be aware of that. If you don't advocate for yourself, you will never get nowhere. That's facts. Let them know. In regards to work-life balance, what do you want to know about work-life balance? Ambitious. What do you want to know? I love Patho. Oh my God, I made 100. Right? That's what I'm talking about. Jenny's laughing. What else we got? Understanding A&P 1 and 2 in regards to work-life balance. Look, in regards to work-life. So here's the thing. If you want to know something in regards to work-life balance, listen to me when I tell you this. When you leave your job, leave that job at that fucking job. Don't come home and bring that nonsense with you. Don't come home and bring don't come home with it. Don't come home with it because people at home are not gonna, unless they work in specific areas like that, like as nurses or they can sympathize. Don't bring that home because all you're gonna do is bring whatever negativity, if it's somebody who passed away, or if it's somebody that you don't get along with in the hospital, such as doctors or nurses, or if you had shitty ratios or whatever, leave it there. Leave that shit there. Be home to be home, vacation when you vacation, and leave work at work. Also, PTO. Take that shit. You want to know why? Because PTO stands for prepare the others. Manning is not your problem. That is a management problem. So that's my advice for work-life balance. Let me see what y'all got. How to know what specialty to go into. Thank you, Megan. It all just depends on where you want to go. Think about it. Where do you want to go? Do you want to go to the ER? Do you want to go to the ICU? So find the fast track to get there. If you don't know where to go to MedSurg. Hell, if you want to go to MedSurg, go to MedSurg. I said I didn't like a unit, and I said if I can't change units, I'll just leave. They let me change. Look at that. Ain't that something? Immediately. Look, when I worked in the ICU, I went straight up to the manager and I said to her, I hate this place. I hate this place. And I quit. And she was like, oh my God, no, why? And I was just like, here. And I broke out this book. Like I had like this green army military book that I have. And I went through the list of telling her all the things that were wrong. And so I told her, she was like, well, I want to keep you here, blah, blah, blah. You're an asset, whatever stupid shit that they tell you. And then she was like, where do you want to go? I want to go to the OR. And she's just like, okay, next thing you know, I'm down in the OR. Who would have thought? Whole life changed. Whole thought process changed after that. I was like, all right, cool, left. Any advice? I start nursing next month. Denisha, what I'll really tell you is you really have to manage. You have to time management. Listen to me. Whoever you out here hanging out with, you really about to find out who your real friends are once you start nursing school. All right. So time management, because you're about to get flooded with so much information. You're not going to have time for nothing. OK, so be aware that you need to manage your time. Do you prefer nights or day shifts? I prefer days. I worked on nights for almost a year. And it really fucked with me. And I don't like it at all. I did not like it at all. I had to go. If I had days off, it took me a whole day or two to recover. Some people are night owls. I'm a night owl, but not for fucking that. Especially if I have to wake up and it's stupid. So I don't recommend nights. I honestly don't recommend any new grad going nights just because all of the help and all of the people that you need and all of the learning happens during the day. That's just me. But what day shift nurse who's been there for a while wants to go to nights? None of them, unless they say, hey, I want to work nights. Mostly for shift differential and night differential. Okay. Advocate. Do you think after graduation, nurses should start off in MedSurg? No, I don't think that. I say simply no. Go where you want. Megan, you're welcome. Did you say Army? No. No, Jay. I didn't. It was an accident. Fuck, I guess I did say it. Whatever. Hey, look, my last like 7-8 years in the Navy on active duty was at an Army base. So, I moved from the Peds IME to adult CVICU in a week. Damn, that's what I'm talking about. How was your experience in the OR? So I was a surgical tech for about 13 years before I became a nurse working in the OR. So the transition wasn't terrible. It's just the role that just changed. So what's the difference between ADN and ASN? Can I give NCLEX? What? Can I give NCLEX after completion of my prereqs? So ASN and ADN are essentially the same thing. You're getting your associate's degree in nursing. Associate's degree in nursing or Associates of Science in Nursing. That's all it is. It's a 2-year degree. And once you get that degree, once you pass school, then your school will send all your stuff up to the state, and then they will send you an authorization to test so you can take your NCLEX. So you can't do prereqs, get into nursing school, and then take the NCLEX. You have to do your prereqs, get through school, graduate, then sit for that exam. Okay. How do you manage school and home, like walking dog? And I'm not even gonna lie to you, Megan. Look, I'm a very regimented guy. Okay. So one thing I'll tell you, legitimately get an Excel spreadsheet hour by hour, 6 a.m. in the morning to 6 a.m. the next morning. And you literally document your time. That's exactly what I had to do. And I had to live by that. It didn't take me long. After about 2 weeks, I was married at the time. So at the 2-week mark, we were on a groove. Okay. I work nights. I swear I sleep for like 3 days straight. That's what I'm saying. Cass, what you laughing at? Facts, all of this. That's what I'm saying. Hey, if you guys are new here, make sure you guys follow. Make sure you guys share, right? Make sure you guys smash that like button. I do these Ask Me Anythings after I do a set of questions for NCLEX that I got off nurselabs.com. Some people get so mad at me for the fact that these questions suck. First of all, bitch, they're fucking free. What you mean? What you mad at me for? They're free. Free 99. The fuck? Anyways, I'm sorry. I be getting out of pocket sometimes. I'm calming down, y'all. I appreciate y'all though. I love all y'all. Shout out to all 72 of y'all in here rocking with me. Do you go live with people? You know what? I'm actually working on that. I actually want to bring on other nurses and their experiences, and kind of do like a live type of Q&A. I'm thinking that's actually been like on my to-do list on that thing that's back there. So there is no difference really. In what, Natalie? What are we talking about? That helps so much. I'm glad I helped you, Megan. If it's free, it's for me. Shout out to you. I'm so nervous for starting nursing school LPN. Don't be nervous. Hey, pretty love. If you're scared, go to church. That's what I tell everybody. If you're scared, go to church. Because guess what? You being scared has nothing to do with denying the inevitable. School is right there. It's over there, right? It ain't going nowhere. It's stationary, right? Now it's there. Now how are you going to tackle it? All right. VM says, for anatomy, what do you think would be essential to review before health assessments? So anatomy and physiology and health assessments are obviously they're two different classes, but for health assessments, you got to work from top to bottom, right? You got to look at what is happening. Like, what are the important things that I'm looking for when I'm going down each body part? Like, what am I looking for on the patient's head? What about my eyes? What about the nose? What about my mouth? Then I get down to the chest, the thoracic area. What am I thinking about? What are my heart sounds? What do they sound like? Right? What do my lungs sound like? Right? Which lung has 3 lobes and which one has 2? Right? So there, you can throw the anatomy in there like that. Right? What am I looking at? Any type of telling issues that are happening in my arm. Right? So look at my neck. What if I had a pneumothorax and I had, a tracheal deviation? Right? Or if I had, jugular vein distension, right? So when it comes to assessments, it's looking at all of the issues that are happening with the patient from head to toe. Once you further get into doing health assessments, you'll go from doing a full head to toe assessment that you're going to do in school to doing a focus assessment to where it's just like, hey, what is the chief complaint? What is the thing that you focus on? But never forget your head to toe assessments. It's never going to go away. Nurse labs are good. Some are crazy hard. And my school uses them sometimes. Hey, they work. Kathy, thank you for the follow. Rebecca, thank you for the follow. I start LP in school and I'm ready, but I'm nervous. It's okay to be nervous. It comes with the territory because it's something new, right? But then before you know it, with you being there 2 weeks, that first test is going to humble that ass. Trust and believe me when I tell you. But once you get through a rhythm, and you get, you start doing things, step by step, you're going to be all right. You're going to be all right. Brandy said, we just did our head to toe check off. It was rough. It is rough. It's rough because it's something that, that you're not used to doing, so just think about that. But practice. Here's the thing, Brandy, practice, right? So if you have a boyfriend, girlfriend, whatever, use them as guinea pigs like everybody else does. Use them as guinea pigs. All right. Tell them to lay on the couch and then you just do the head to toe assessment. Break out that stethoscope. If it's cold, put it on them. No, don't put it on them. Don't be mean. Especially don't do it to babies if you have kids, okay? So there's that. Tension Pneumo. VM says, thanks. I'm always jealous of how nurses do head to toe so quickly just by looking at the patient. That Catherine, that's what comes with practice. Hey, dude, I'm late, but I'm here. Happy mom, man. We already done with the questions, but I'm glad you're here. ATI in nursing school makes exams much harder than the NCLEX. It took me 30 minutes to finish the what? Oh, to finish the NCLEX. It took you 30 minutes. It took me an hour, like an hour five, like a little over an hour. This semester is really humbling my ass. Exam 2 on Monday. Shout out to you, Rachel. I know that you're gonna go out there and you're gonna rock it. First semester clinicals tomorrow. Who says that? Banana. All right, cool. Shout out to you. Tori says, just graduated my LPN to RN Bridge. Time to take NCLEX. Shout out to you, Tori. You're going to do all right. Yep, 30 minutes in and out. Well, aren't you smart? Your name is Deja, right? Did I say it right? Is it Deja? Or Diasia? Deja Carter. Miss Carter. I'm calling you Miss Carter. Hey, Miss Carter. I got you, Miss BSN RN. I see you out here. 30 minutes for NCLEX. Wow, that's what I'm telling you. Like, she has smarty pants out here zooming through it. CCRN, shout out to you. I thought about going for all those certs, and I realized, and for me, it didn't matter. Now I'm just going for my master's degree. I'm just gonna go get that in education and call it a day. Congratulations to everyone who is graduating and starting school. Shout out to everybody. Gotta go. Have a patient being flown in. Keep up the good work. I appreciate you, man. I appreciate you being here, man. Thank you. Go take care of that patient. Actually really like med-surg clinicals. Nursing is fulfilling. Just saying. Yes. So here's the thing about nursing. Nursing is fulfilling. It all just depends on where you want to personally go. And once it no longer becomes fulfilling, that is when you need to leave. Not leave nursing altogether, but do something different, to give yourself more, something that's more fulfilling. That's why nurses switch from ICU to med-surg or go from med-surg to wherever, I love this. I'm so excited about nursing school, but nervous. Love my babies. I'm just saying. Oh, because you're trying to go to NICU, right? You're trying to go to NICU. Happy mom. I think I remember you saying that. But shout out to all y'all. We got 71 people up in here rocking with me, man. Got 17,000 likes. Hey, if you're new here, y'all can ask me anything. Essentially, we're talking about nursing school, nursing in general. Got any military questions? I've been in the Navy for 16 years. I got about 5 minutes left before I leave. So what y'all got for me? Deja, Miss Carter, appreciate the follow. Thank you. Simply Nell, thank you for the follow. I'm actually going to start posting more TikToks. They're mostly nursing related or something goofy, so that's what I'm going to try. Shafonda, not me saying, but I was about to be like, hey, LaFonda. No, but Shafonda, thank you for the follow. When do you go live? Monday, Wednesday, Friday, 5:30 Central Time. My son is 18 in nursing school. So, Laura, are you in nursing school or is it just your son? 18 in nursing school. My man is getting ahead of the game. What other questions you guys got? Before I bounce? Hey, I'm third semester LPN student. I graduate in December and will be taking NCLEX soon. Any tips? Well, you need to recreate the testing center is number one. You need to put yourself on a study schedule and you need to monitor your time management. Get yourself a good review if you decide to buy one. You need to realize what your difficulty areas are, and you need to start there first. Also realize what type of learner are you? Are you auditory, kinesthetic, visual, read, write? You need to realize that are you auditory? Knowing what type of learner that you are will help facilitate and help you retain information while you are studying for your exam. Not just for your NCLEX exam, but also while you're in nursing school too. You should go live with a GN. I'm a GN and would love to go live with you one day. You're a graduate nurse? Really? I thought you was already a nurse, Miss Carter. I thought you was already working as a nurse. It's all good. So I actually do have a few people. I actually want to come up I need to come up with a bunch of questions that we're going to go live on, right? So, obviously I don't want people to just sit here and we just talk about random things unless we go off the cuff and we start talking about, different things like, yo, did y'all hear about Britney Spears? Right? I love Justin Timberlake. I said what I said. Anyways, we ain't gonna be talking about that, but just try to keep it on track for all the people that are gonna be a part of it. So I'm scared of needles. How do I get past that? Ooh, if you're scared of needles, you're a graduate. Oh, okay, I got you. If you're scared of needles, you kind of gotta maneuver through that because I don't know not one nurse that can't, necessarily do something, because you got to give shots. You want to work with babies, you're going to be giving babies shots. You know what I'm saying? So you kind of just got to fight through that fear. Trying to find my groove. Okay. And you will find your groove, right? Nothing is meant to be easy. If it was easy, everybody would do it. Okay. So once you find your groove, stick to it, and don't let anyone or anything deviate you from, the route that you have set for yourself. Okay. What is that? Hannah says, keep these lives coming. I'll be here every chance I get. Thank you for the review. Hannah, you're welcome. Hey, so also when I do these reviews or when I go through these questions, I put them up on YouTube as well. So if you happen to miss one, just go to my YouTube channel, The Boot Nurse, and you guys will see those videos up there. Okay. So what else we got? No, I'm scared to get stuck. I can stick. Oh, I got you. Mad facts. Okay. Chris Hansen, go ahead and have a seat right there. I'm sorry. But, so, hey, that kind of comes with the territory. I've been stuck so many times, not even lying to you. I'm nervous about doing IVs. The best way to get better at doing IVs is to do them. Once you start, I'm telling you right now, there's so many people that, like if you get downtime in a unit, they love practicing IVs on one another. That's the only way that you learn. And of course, doing them on patients, right? But some patients are like, hey, I don't want to be the guinea pig. And that's okay. You just got to be understanding of that. Okay. Well, ladies and gentlemen, it is 7:30. I kind of got to go, be a dad. I just can't be abusing my folks out here. So here, I'm going to leave you guys with a little bit of parting words like I always do. Be kind to yourself, because there's only one you. I don't give a fuck about nobody else. Right. And I say that metaphorically, but I mean that seriously. All right. If you can't take care of you mentally, physically, spiritually, emotionally, you can't take care of nobody else. Not no fucking husband, not no fucking wife, not them goddamn kids. Because fuck them kids. I'm just playing. I love my kids. OK, but what I'm saying is take care of yourself. You have to take care of yourself. Also be kind to yourself. You only get one you. You only get one you. All right. And if you can't take care of you, you can't take care of anybody else. All right. So that's going to be my parting, nice, kind words. I kind of say that all the time, but I mean that shit, like, because, I go through it. Everybody else goes through it. But unlike some people who want to fucking suffer in silence, I won't do it, and I won't let you do it. So, that's my last spiel. Last little plug for myself is, if you know anybody who's graduating within the next 6 months, tell them to check out the 7-day NCLEX course. That link is in my bio. It's going for $48 for a lifetime, which means you get updates. I have 42 videos in there. I'm probably about to add like another 15 videos over the next week and a half to include the new generation NCLEX review that I've been recording for the last 2 or 3 days. So that's going to be going up there as well. And if you need help with NCLEX, like you need one-on-one coaching, you can check that link out in my bio as well. But the NCLEX review, $48. It's $48, $48, y'all. And I'm telling you right now, eventually that price is going to go away. It's going to go away, I promise you. So, yeah, hope everybody has a great rest of their week. The next time we're going to go live is going to be Friday at 5:30, same time. And I hope everybody does well. I thank you all for all being here. Thank you. And I will see everybody on Friday at 5:30 Central Standard Time, because it's Texas time, and that's the only time that matters. All right. Peace out. Bye.